I lost my voice, so I don't want to irritate your ears with the sound of my voice. First, I want to thank you for asking me to come and speak. I saw a lot of hands in the audience go up when we were asked how many parents were here. So there are many of you who are also caretakers of either older children or younger children, as the case may be, who have walked in the same shoes I've walked in 17 years. My daughter was first diagnosed at the age of 9 with RSD in her wrist at AI DuPont Children's Hospital by a resident, not by the doctor that was actually treating her, after a break in her growth plate of her left wrist. He on the side told us that we needed to get to Jefferson right away because after they had changed her cast twice and she still was in pain, had black hair on her wrist, her arm was very discolored and you couldn't touch her hand, as well as her hand was positioned like this and couldn't be moved. He recognized that there was something more than a fractured growth plate. Her father made some connections at Jefferson, got in touch with some people there that were familiar with RSD as it was diagnosed at the time. For a series of months, we took Katie to Jefferson, got nerve blocks in her neck, and took her directly to a hand therapist who worked with desensitization in her hand and on her skin. It was a very dreadful experience to listen to her scream, but after some time, we got Katie back to what we thought was pretty normal. I'm just going to skip ahead between the ages of 9 and 15. Katie had symptoms that no one else would ever have, from ant bites to, hitting her arm, increased pain. We lived the life of being told that Katie wanted attention because her father and I were divorced, and she would do anything to get that attention. Her brothers made fun of her when she was younger. She's the next to the youngest, and called her drama queen, all the things that people go through. So Katie endured a lot of mental distress as well when she was growing up. But we never really tied, between the ages of 9 and 15, those strange things back to the RSD, because they didn't carry the same symptomatic discoloration, swelling, skin sensation. Just she was her body overreacted to anything that happened. She also underreacted to any type of medication for numbness, dental appointments, Novocaine. It never worked on her. When Katie was 15, she was a junior Olympic volleyball player. We're from Delaware. Katie played in New Jersey. She also played basketball in high school, and she tore a meniscus in her knee. She chose to have a meniscus repair done this spring before her next volleyball season so that she would be healed. Had a great orthopedic surgeon, did the surgery. Katie came home. 3 days after she was home, the incisions popped open, red circle appeared around her knee, and she was in excruciating pain. She began to develop lesions on her leg. My daughter probably has, just out of the research that I've seen, the worst case of skin lesions from RSD that I've ever seen. In fact, 3 years ago, she had them over 90% of her body. And I'm talking this big at sometimes on her thighs. Her doctor, her orthopedic surgeon, accused her of picking her leg and casted her leg over top of the surgery. We had another doctor, because they thought she had gotten an infection during that period of time, an infectious disease doctor who was treating her for infection, and she was getting vancomycin. The nurse came to the house to infuse her, and she had an anaphylactic episode from the vancomycin. She was rushed to AI DuPont Hospital. They took the cast off. Just want to summarize the story for you. Katie was in there for almost a month. She lost her vision in her left eye. She lost hearing in her left ear. She would get red racing stripes down nerve paths that you could just see appear on her. At one point, she turned red in her whole left quadrant, and her jaw, she couldn't move her jaw, her left jaw. They gave her Solu-Medrol to try to clear up her vision, which it did work. And although they couldn't really figure out what was wrong with her, they brought in a dermatologist who said she was picking her own skin and making it bleed. We had an infectious disease doctor there who told us he thought she had osteomyelitis. So we transferred her from from AI DuPont to Christiana Hospital. Went through a series of treatments there. When they tested the fluid on her knee, it came back negative. The insurance company wanted her out of the hospital. So her father actually got into a confrontation with the doctor. I mean, how do you tell a patient you've got an infection of the bone and then tell her he was wrong? He also said that she was making this up, that she wasn't really in the pain that she was in. And we saw a nurse get in trouble that day for standing up for Katie and saying that she had actually seen all this happen with her own eyes. I was accused of the Munchausen. Everything that was up here, every symptom that's up there, Katie has endured. And she's 26 now. We were not officially diagnosed again that all of these things were truly RSD related until 3 years ago, in 2010. Katie ended up in Christiana Hospital when the RSD had caused problems with her bladder, her heart, her breathing. She had all the other brain fog, Katie was treated for ADD almost her whole life and never had it. And that was when she had the lesions over 90% of her body. Dermatologist there, Dr. Zepp, came in and said to her, I know your mother has fought with the medical doctors, which I have, believe me. Short of physical, I've really got into some pretty strong confrontations. He said, but I need you to get to Jefferson, to Dr. Guido, who specializes in blistering diseases, which is where we had the punch biopsy done, who hooked us up with Dr. Schwartzman immediately. Katie was a patient of Dr. Schwartzman for a few years, and for various reasons, we ended up not being able to go there anymore. However, Dr. Schwartzman did write us a letter asking us if we'd like to participate in a stem cell research program, which we never heard anything more of. From that point, for 3 years, almost 3 years, Katie had no treatment at all because we had no doctor. And as a caretaker, the one thing that probably all of you know, as well as I do, is that patients that have this disease, just like a heroin addict, will do anything to get the treatment they need to feel better. Anything. Look on the internet, talk to people, email people, contact people that have been to Mexico. I mean, I have a lot of friends here that I've made friends with just by reaching out to them and saying, please give me the name of another doctor. Because Katie started out in a wheelchair with Dr. Schwartzman with a catheter, and that's where she ended up 3 years ago. Right back where she started. They have to have treatment. They have to be able to get their treatment. And I can tell you that in the state of Delaware, although it's gotten better, no one there really knows this disease. At this point, Katie has every possible symptom that you can get from this disease. She has gastroparesis. She straight casts herself 3 to 4 times a day. She can't go to the bathroom. She's in chronic pain. She has a spinal cord stimulator. This is her first. The doctor that she's been seeing, who administers ketamine, which is a completely different protocol than those talked about today, that he uses, basically said, you've never tried it. Let's see what it does for you. She did get some immediate relief, but I'm not sure for how long that's going to last. So it's so important that we spread the word about this as best we can. My family, I know, everywhere we go, every opportunity we get, we tell people, sometimes haunting them and explaining to them about this disease. Just in summary, I want to tell you, some of you know that my daughter would have loved to have been here today, and I would have loved to have had her. Katie developed an infection in one of the lesions that she got on her foot from twisting her ankle maybe 2 months ago. That infection, cellulitis, ended her up in the hospital where she received IV antibiotics through her port. The cellulitis started to clear up, and about 2 weeks ago, I don't know what day we're even on now, she was released home with home infusion for antibiotic for the cellulitis. Her port was re-accessed on Tuesday for the antibiotics, and on Friday, a week ago, yesterday, Katie ended up back in the hospital with sepsis. She was treated with antibiotics for the sepsis, developed some heart problems as a result of it. Got a nice private room in the heart wing of Christiana Hospital. Her heart rate dropped down in the 20s. Rapid response team was called. It was pretty touch and go. But Wednesday night, she was able to move back out of the heart wing, back to the regular floor. Her port was removed because the bacteria was living on the port. And Thursday night, had to get that awful PICC line because there was no other option for her to receive the antibiotic. She's in pretty bad shape right now. She's very weak from the infection. She's in a lot of pain. 4 days she went without her medication, so she started through withdrawal. She's one of those patients that takes opiates, and that's the reason why I asked. Her list of medication is very long. She sees a pain management doctor right here in Philadelphia that Dr. Schwartzman originally sent us to, who is the prescribing doctor. Whether she should or shouldn't be on them, I'm not a doctor. I just know that it relieves her of some of the pain that she has from other reasons, probably causes her other problems with the other pain. But we have to see someone who can balance the two and get her to a point where she can live her life the most comfortable way that she can. Couldn't do it without her dad. I work in New York City, near New York. Katie's fiance, Joel, takes care of her. She lives with him. Don't know what we would do without him. Been with her for 6 years, been with her when she was better, and stayed with her up till now. So we hope he sticks around. But if there's one message that I can deliver here is, don't ever stop fighting for those that you care for. No matter how much resistance you get, no matter how mad those doctors get, and I know there's some here, they don't know everything. And it's the ones that don't admit to not knowing everything that are dangerous. If they admit we don't know yet, if they admit to the fact that they're researching it, if they share that with you, that's who you want to stay with. If they tell you, like we were told, RSD doesn't cause those lesions, I don't know what that is. RSD doesn't cause, the pain that your daughter has. It doesn't cause heart palpitations. It doesn't cause, it's not true. So 17 years of non-treatment will end your patient up where my daughter is. So just keep fighting, and keep standing up for what they need. That's all I have to say.
And I want to add that like 10 friends, family members of Katie's are here today. So somebody's doing a good job. Hi everyone, I'm Jessica Feinberg. You probably have heard my name passed around, read Nancy's book. My story's in it. I'm going to try to make this as fast as possible. I know it's been a long day. I'm now back in school for social work and want to talk a little about the social worker and family dynamics as well in patients with CRPS. And then a little bit about my story. I had bunionectomy at the age of 19 and never got out of pain from it. I called my doctor 6 weeks after my surgery for a refill on Vicodin, and he said he never had a patient call for a refill for a bunionectomy before. So that was the first sign something was wrong. Then he started giving me cortisone injections, which led to me thinking my second toe was too long, and that was causing me to have the pain. And luckily I have a wonderful father as a doctor that ran me out of that office and never stepped back in there. I had I went to see an orthopedic surgeon and had scar tissue removed from my big toe, and because they said you can't bend your toe, and that's the problem. that's when my pain began to spread up my left extremity. Luckily, it only stayed there. And my mom at the time was seeing a pain management doctor and took me there to see what we could do. And in 5 minutes, they said, "You have RSD." And we were like, wow, finally, something. There's an answer. We were so happy. We go home, we just type in those 3 letters. That was my world shattering. We went after that to see a neurologist that he knew did not treat RSD because he said it was a disease in itself, and neurologists cannot treat it unless they just specialize in it. Somehow my dad's uncle's name came up at this appointment, who used to work at Drexel. And I got in to see Dr. Schwartzman in 2 weeks, which is very unfreak. It does not happen. Ended up not getting treatment from him. However, he confirmed the diagnosis and sent me to the hospital for special surgeries to get the special MRI because he thought I had neuroma. Not only did I have a neuroma, I also had avascular necrosis, which I had no blood flow going into my big toe. So I had a hip-to-toe bone marrow transplant, a cryoneurolysis, which they froze the nerve and buried it in the bone, and I had a ketamine epidural at this appointment, or during the surgery, and I was on fentanyl patches, Percocet, and a morphine PCA, and I got pain-free from RSD for a month. After that, we were at a loss again because we were told $45 grand out of pocket. We didn't know about healing insurances at that point because we hadn't met Nancy yet. For all of that, as everybody's gone through, these treatments that did not help. I had the injections, I had the tests, the EMGs, you name it, I had. The hyperbaric oxygen chamber, none of this did anything. And especially the pain medication, which I did not believe at the time, made things so much worse. I can't even tell you. I was at a point that I was on 500 milligrams of morphine a day. And that's when I met Nancy, who told me that I needed to get off of this medication. Didn't believe her. When I started to wean off, my pain got better. Yes, I was going through withdrawal, but my pain got better. It does work. I'm living proof that getting off of those pain medications, they do not help. More things that I've done is anyone familiar with CHOP and their program at all?
Dr. Sherry?
Yeah, Dr. Sherry's program at CHOP. There's one in Pittsburgh where I live they were trained by Dr. Sherry. I tried doing it outpatient at first. I would come home worse than I was there. This desensitization was the biggest thing, and I was in tears. I couldn't even do it. They were pretty much doing it for me. These are all the treatment. The list goes on. I could take up this whole time telling you all the things that I've tried, but I'm not going to. But this day, July 30th, 2012, was the saving day in my life. I had a 5-day high-dose outpatient ketamine infusion in Florida, and at half dose, which was half a milligram per kilogram at the time, and had been CRPS pain-free since. I do have EDX, and I spent 6 years in bed. So I do have pain, but you looked at the scale, I give myself, go ahead, yes?
Sorry, was that, when you said Florida, was that with Kirkpatrick?
No, it was not with Dr. Kirkpatrick.
Who was that with?
It's with the Dr. Patton that I would not refer anybody to because it's not reliable at this point.
Oh.
With his